Well, first of all, thank you for having me on the program. I think that if there is a vaccine, it should be owned by the public because it is not permissible from the perspective of let's say, professional ethics. If a researcher does have a vaccine and it can be produced in reasonable amounts so that we can use it for many people, in particular those that are at the highest risk, that it should be limited to one country. This is at least my perspective from the ethics point of view, and I think this is a perspective which is shared by many of the German people and also by our government. This is why our government made it clear that we do not want our prime biotech companies working on vaccines, RNA or different, to be exclusively available to Germans only.
Karl, there have been so many conflicting messages from the start of this coronavirus pandemic, and first up WHO, who we spoke to, saying there should not be border restrictions. That was very early on when China was implementing them. Since then, they've now swept across various different jurisdictions, and the next debate is whether you see even border restrictions within countries, not just across countries. Just give us a sense of what you make of this, given how infectious coronavirus is.
Well, first of all, we have new studies. So the dynamics that you see here in the legislation and that you see in the recommendations also by researchers is not due to, let's say, conflicts of interest or, let's say, mistakes that were made early on and so forth, but we have a very dynamic field in the research itself, and we have to take this into consideration. We cannot go forward as politicians and say, well, we go with what we recommended yesterday, despite the fact that today we have other evidence. So to give you just one example, it is by now quite clear from some of the best studies that have come out only very recently that a number of the cases, most likely even the majority, is transmitted by those who do not yet have symptoms or who actually may never develop symptoms. That has happened in China. This explains a very quick initial spread, and this may also to some degree explain what is happening in Italy. So we must expect a large proportion, if not the majority, of the cases being transmitted by those who have been exposed, who carry the virus in themselves but do not show any symptoms or only minimum symptoms, so that we have to consider them as contagious but not really sick. And that is a strong argument for basically shutting down public life and coming up with travel bans, because then you cannot rely on focusing on the sick, that then you have to rely on everyone. Limit exposure for everyone, because the majority of the people who expose others are not really sick.
Hi, I'm Joanna Bersecci, and thank you for watching. You can check out more of our videos by clicking on the boxes on the screen. And don't forget to subscribe to our channel for more from CNBC International. Thank you for watching.